Hello there, Dr. Joanne Michelle Martin here, pelvic floor physical therapist specializing in the pregnant and postpartum mom. But today I wanted to speak to a specific group, and that is cyclists. So whether you are a hardcore cyclist competing in triathlon, or other races, whether you're a mountain biker, whether you are a weekend warrior, just going on road races with your group on the weekends, whatever have you. This is specifically for you. Typically, one of the issues that cyclists may have, and it's not something that should be apparent always or immediately, but certainly it's something that needs attention when it does happen. If you are having any numbness, any tingling, any burning, any pain in your pelvic region, you definitely want to seek the advice of a pelvic floor physical therapist. Typically, after long rides, most cyclists may complain of discomfort similar to this, which is not uncommon because they have been riding for a long time. And when I say riding for a long time, I'm talking about if they've gone out and ridden for, more than an hour or two. Excuse me. So this would be the triathletes and a lot, especially those competitive riders, but certainly it could be just the weekend warriors as well. What this can be is it may be something called pudendal neuralgia. Your pudendal nerve isn't one of the nerves that comes from your spine, and its bunch of nerves comes together and it branches through the pelvis. Based on how you sit, and if you're sitting for prolonged periods, you could be compressing that nerve and thereby irritating it. Excuse me. And thereby irritating it. And when this happens, and if it's happening frequently, it can become problematic. So again, some of the symptoms that you may notice are burning, numbness, tingling, pain. Some people may notice a change in sexual function, especially men. You may notice that you're either unable to have an erection or you're unable to maintain an erection. People may complain of painful sex, and people may also complain of burning with urination, and even in severe cases, leaking. Now here's why. Your pudendal nerve has two functions, motor and sensory. And what that means is when it travels to the different muscles in the region, it either can facilitate their movement, so it can help them move, or it allows them to sense and send signals back to the brain. So that numbness would come in if the sensory part of the nerve is affected. And some of the burning, tingling, pain may also come in with if the sensory portion has been affected, or sometimes if the motor part of the nerve has been affected. The reason for this is typically, again, when cyclists are sitting, they tend to sit in a posterior pelvic tilt. Now, this is normal to some degree. Understandably, though, if you're riding for a long time consistently, it can pose a little bit of a problem for some people. Part of that is because of an improper bike fit. So while you're going to be in slight posterior pelvic tilt, and this is functional for cyclists, you want to make sure, first and foremost, that your saddle is appropriate, to your height and for your bike, so that you are not in an extreme position. And I will show you here. Here is a pelvis. This is the sacrum. So you see the lumbar spine here, and this is the sacrum. When the sacrum tilts backward, that is a posterior pelvic tilt. And usually when that happens, the lumbar spine tends to tilt forward to compensate. So that's where we get that. That causes a little bit of stretching to the musculature in through here. Sometimes those muscles can become very irritated. For instance, your piriformis muscle, some of the other hip rotators. And when they become irritated, they may shorten, and that can cause increased tension and pressure on the pudendal nerve. Similarly, if you are being put in too much of a posterior pelvic tilt, then what tends to happen is it tends to affect the coccyx and the coccyx position. So now you're sitting more, you may be sitting a little bit more on the tailbone and irritating the tailbone somewhat. And a lot of the muscles of the pelvic floor, especially the deep muscles of the pelvic floor, attach to your tailbone or your coccyx. If these muscles are irritated and affected, or if these muscles are in a position that is not optimal, it can cause muscle fatigue, especially if you're out on those long rides. And that can be, somewhat problematic in that it can impair muscle function. So again, people with issues specifically affecting the muscles may complain of incontinence. They may complain of leaking. With regards to the burning and tingling and numbness, most of that is typically felt here in the genitals, in through the perineum, which is the area between the genitals and the anus, and even sometimes as deep as the anus with the activity. So if you are a cyclist, again, and you are having any issues with burning, numbness, tingling, pelvic pain, any leaking, any issues with sexual function, males, whether it is obtaining or maintaining an erection, or male and female, whether it is painful sex, you definitely need to seek out the help of a pelvic floor physical therapist. You can find these locally to you, or many pelvic floor physical therapists will offer online consultations. Additionally, you want to seek the assistance of your local bike shop. So you want to go to your local bike shop and make sure that your saddles are appropriately fitted, so they're not too low, they're not too high. You also want to make sure that you are changing your saddles appropriately. The saddles are nice and cushioned, but that cushion will not stay there forever. Kind of like a runner whose, shoes are dependent on mileage count. So you run about an average of 300 miles in a shoe. If you're running 50 miles a week, your shoes aren't going to last you as long as someone who's only running maybe 5 to 10 miles a week. So again, you want to be mindful of these symptoms. They will start to be present if you're doing more long rides. So typically most people doing short rides may not notice it because they're not in a position for a long enough period of time that may be compressing that pudendal nerve. If, however, you are noticing these symptoms, first and foremost, go to your bike shop, get your saddle checked. Again, bike fitting is very important. If your symptoms persist, definitely see a pelvic floor physical therapist. If you have any questions with regards to this, please feel free to contact me, info@jmmhealthsolutions.com. Thank you so much.